Well, there's been some very interesting developments in terms of just treatment. So one study we've been involved with Dan Freeman in Oxford is looking at worry and psychosis and paranoia. And it's obvious when you think about it that people who are paranoid are very worried about what's happening to them. So using the sort of techniques that have been used with worry in anxiety and generalized anxiety disorder, it's been shown to be really effective, helping people understand why you worry, how it can be helpful, but how it can also be negative. Beginning to develop some problem solving for it. And also, and I think we were very surprised that patients really took to this, but having a worry period. So talking to patients about, why worry all day? It doesn't get you anywhere. Why not select a period during the day, half an hour or so, in which you're going to do your worrying, and then you're going to leave it behind. And I have to say, we were very skeptical that this might help, but in fact patients taken to it very well. The paper was published in The Lancet a year or two ago, 2015, and showed really quite significant effects, not just on worry, but on quality life and conviction in the beliefs. So it's a simple 6-session intervention that's helpful. There's also work going on sleep, because we know sleep exacerbates psychotic symptoms, and again psychological treatments can help with that. And probably the most important is also on how we can see that these techniques are made most available. It does seem that some of them need continuing boosting. So we did a study on clozapine patients who had CBT, had persistent symptoms. What we found was a really good outcome at the end, but when the therapy stopped, the effect began to reduce. And just as if you'd stop clozapine, you'd expect the effect to reduce. We also need to have ways of maintaining that, probably using community care workers, community nurses and others in that.